Dr. Quinn, when a person is diagnosed with COVID-19, what responsibility do they have to their employer?
There's a tremendous responsibility that this employee has. This is a time when we have to think about others in regard to just thinking about ourselves. And what I mean by that is there's a concern by a lot of employees, if they let their boss know, they might lose their job. And right now we're going into a financial crisis. But at the same time, that employee has to understand by letting his boss know he can be removed from the workplace safely so that he can be treated and recover. But at the same time, he won't expose the rest of his colleagues, the rest of the employees on the work site, and also the people they serve. Because if he stays at work and not let anyone know what's going on, then other people can become infected and they can get sick, but they can even take it home to their parents or other loved ones that might be immunocompromised or elderly, and these people can lose their lives. That's why it's so important that you let your employer know so that you can leave the job site and just think about the community as a whole.
Now, say your symptoms never become severe. When can you safely go back to work?
Well, there are some new CDC guidelines, and these guidelines specifically state if an individual has been fever-free for at least 3 days or 72 hours without the usage of any type of fever-lowering medication such as Tylenol or Advil, the person has had a very, very significant reduction of respiratory symptoms to include cough or shortness of breath. And there's been at least 7 days since the person developed symptoms. At that point, it could be considered for the person to go back to work. But I really like to include that I suggest that that individual also follow with their medical provider so that they can be properly assessed and their specific individual situation can be evaluated by a medical provider. At that point, their return to work date can be determined for safety.
That brings us to our next question, Dr. Quinn. What about a follow-up test for coronavirus? Could you get that, and should you get that before you go back on the job?
The bottom line is, in a perfect world, everyone would be tested before going back to work. But unfortunately, there is a shortage of tests. So we medical providers in the medical community, we're doing everything we can to get as many people tested as possible. But in the event that the test is not available, we follow the CDC guidelines and make a very educated decision on when it's safe for that individual to go back to work. But for those individuals that work in nursing homes or critical care units, which have elderly and immunocompromised patients, it's really a good idea to exhaust every means possible to get them tested so that we can make sure that they're safe to go back to work.
All right, and lastly, Dr. Quinn, are there any foods we should be eating or other steps we can take to help lower our risk of developing those severe symptoms from COVID-19?
Most definitely. I mean, if you look at the data, the analysis, the majority of people who have an adverse medical course with this infection have weakened immune systems. So anything we can do to strengthen our immune system, such as eating healthy, getting plenty of sleep, exercising, but still maintaining social distancing. And if you have a chronic medical condition, be 100% compliant with your medications and follow the directions of your healthcare provider. And this will better ensure that you'll have a better course and less likely that you'll lose your life.
All right, Dr. Timothy Quinn reporting live. Are you from your clinic in Ridgeland today?
Hey, thank you so much.
Thank you so much for taking a little time. You're watching 12 News at Noon.